Hello, good people. How are you today? I hope that you are doing well in every area of your life. So, today is June 6th, which makes it the sixth day of Uterine Cancer Awareness Month. And as I've been saying, I consider myself a uterine health advocate from sharing my journey and also taking it a little further by providing information about uterine health. And I thought it was important for me to align myself with the awareness month, since that is what I plan to continually advocate for the education and knowledge of everything regarding our uterine health. So I thank you so much for engaging with me by subscribing, liking, commenting, things of that nature. So thank you so much. So my full disclaimer is in the bio, but I will just let you know I am not a medical doctor. I'm an advocate, someone that wants to get the word out to spread the awareness about all the things regarding the uterine and our uterine health. So bear with me as I learn to pronounce this word, right? But have you ever heard, and so I got my little cheat sheet here. Let me bring it closer so you can see the word. Have you ever heard of adenomyosis? Adenomyosis. I've never heard of it either. I was doing research about what should I talk about next for, one of the 30 days, and then I ran across this. Adenomyosis, I know I probably butchered it, but I'm trying, is another condition of the uterus that I just discovered, like I said, when I was doing my research. It is little known, it is under researched, and often overlooked. So, this is why, as I present information to you, it's just for your own knowledge. So, now if this is something that's little known, under researched, and often overlooked, as you are listening to me share this information, this is something that you can then present to your doctor. Like, hey, do you think I have adenomyosis? Adenomyosis. Do you think I have that? So I'm going to tell you what it is. So, of course, I did my internet search of the word, and I said, "What is it?" Because I was looking up something else, and this word came up. And so, adenomyosis occurs when the uterine lining grows into the muscle wall of the uterus itself. So your uterine lining, I can't describe it. I wish I had a picture or something like that, but this occurs when the lining grows into the muscle itself, the wall, into the muscle wall of your uterus. And they say it's almost like the cousin of endometriosis, which stays out of the muscle wall, but this particular adenomyosis, grows within the muscle wall. And they said this condition affects about 20% of women and often causes your uterus to enlarge and become tender. So one of the tell signs, and I'm also going to get into some key symptoms, one of the tell signs of this is that you have heavy, painful periods that seem to get worse over time, severe menstrual cramps, and pelvic pressure during intimacy. And as women are suffering from this, they describe their periods as becoming increasingly unbearable. And I think to myself, a number of friends and people that I've known throughout my life that have just had some really tough, really tough menstrual cycles. So I can kind of relate and understand. So some of the key symptoms of, I'm going to keep saying this until I get it right, adenomyosis is, they said sometimes you can have no symptoms or you can only have mild symptoms. But when you do have symptoms, it's the heavy menstrual bleeding. Periods can be exceptionally profuse and may last a long time. You can have severe cramping. You have intense pelvic pain, cramping, and bloating during your periods. You can have an enlarged uterus. The uterus can grow up to double or triple its normal size, and sometimes it's so visible that it's protruding out of your lower abdomen. Wow. And you can have painful intercourse so that it's then, sexual activity is not pleasurable for you at all. Or you can have chronic pelvic pain. So those are just some of the key symptoms. And I'm looking at this. So the causes and the risk factors, you want to know, like, where did this come from and what are the risks of having this, right? So the exact cause, they say, is unknown, but I'm going to look right here. Adenomyosis is most frequently diagnosed for women between the ages of 35 and 50. So this is something for women who, are a bit younger, but it's still something to know if you're out there, you're between that age group, or if you know someone that is. And it's mainly diagnosed, most frequently, I should say, diagnosed for women who have given birth or had prior uterine surgeries like a C-section. Some medical theory people, because they're still trying to figure this out, suggest it occurs when the border between the uterine lining and the muscle wall is disruptive some kind of way, and that's what causes this adenomyosis. Adenomyosis. So some of the, and if you ever diagnosed with this, they do have some kind of treatment options as well. But let me tell you one of the ways that you can, maybe if you think that someone that is suffering from this, or you yourself are suffering from this, that when you go to your doctor, you might want to bring this up if they don't bring it up to you, because remember, it's little known and often, not even diagnosed. So when they do, they can kind of, diagnose you through a pelvic exam, and then they do a lot of visualized tests of the uterine wall, and that could be a pelvic ultrasound, or you might have an MRI. So if you think you are suffering from any of the, heavy menstrual bleeding, severe cramping, enlarged uterus, painful intercourse, or chronic pelvic pain, even if your doctor doesn't mention it to you, maybe you could mention it to your doctors as well, to see what is going on, especially if you're between the ages of 35 and 50, and you gave birth or had some kind of prior uterine surgery like a C-section. And so if you are ever diagnosed with this, they do have treatment options for you. So, of course, I'm going to say the word again. Adenomyosis is a benign, non-cancerous condition. So praise God for that. It is a benign, non-cancerous condition. Let me say that again. And the symptoms typically resolve after menopause, when your hormone levels drop. So if you are having these symptoms prior to menopause, you might have to take some kind of anti-inflammatory drugs, some over-the-counter pain reliever medicine to manage your menstrual cramps. Your doctor may prescribe you hormonal therapies like birth control pills, patches, IUDs, and things of that nature. And in some severe cases, you might have to have a hysterectomy. In severe cases, is what it's saying. So again, if you are experiencing any of these symptoms, and you are between the ages of 35 and 50, I would, again, consult your doctor and discuss your plan. And if possible, request that maybe an ultrasound or MRI test is given to you so you can properly know. I always say, don't self-diagnose yourself because you see someone talking on social media, or you see the first thing that comes up online when you do your internet search. It's always best to talk to a medical professional that you can go over these things with. So per usual, I have 3 articles of reference for you that I will be putting in the description. So the first article of reference I have is from the Cleveland Clinic, and it was done in January 2023, and it is Adenomyosis, the causes, the symptoms, and the treatment. The second one is from the Mayo Clinic. It didn't have a date on it, but it's adenomyosis, symptom and causes. And the last one is from the Women's Care Clinic, the Minnesota Women's Care Clinic. And it says, what is adenomyosis? Adenomyosis. So those are just three, those are three articles to get you started. Once again, I just try to provide you with information, knowledge of things that are out there affecting our uterine health that we may or may not know about, that was maybe misdiagnosed or we didn't have the opportunity to know about it, but now you do. And the more you know about what's happening in the womb area and your uterine, the more empowered you become as a woman, the more empowered you become if you're a man for your partner, the more empowered you can become for your nieces and nephews and children and the future generation, because now you know about these things, and more empowered how when you have your gynecological appointment with your doctor, you can ask different questions. Well, I feel like my uterus is enlarged. Does it have, can we test to see if I have adenomyosis? And they may not know about it because it's little known, under research, and often missed. So this is an opportunity to show you've been doing your homework and to really see if this is affecting you. So I hope this was helpful to you as you continue on your journey, and as you continue to follow me along my journey of sharing good information with you about everything that has to do with uterine health, everything that has to do with uterine cancer. So until next time, and we're all going to learn this word, okay, right here together. So I have adenomyosis. That's what the word is for the day. Okay, take care.